Hello and welcome back. Welcome to segment number, I don't know, segments a lot. Um, Welcome back to the Atlanta Photojournalism Seminar. We are live from Atlanta and also right now from Washington, D.C. We're going to host Victor Blue in just a second. Let me go through a couple of announcements and make sure that we thank number one. We'll be looking forward to at 9 o'clock winners in the categories of the Atlanta Photojournalism Seminar Photographer of the Year, Best in Show, and also the Dave Martin Grant winner. Also, again, thanks very much to our sponsors. Very much, we could not be doing this year without you. You can also watch our programming Monday through Friday for $0. That's right, $0. But remember, you can also purchase access to Saturday's programming for $29 until the end of today. Then it goes up to $49. But we hope you go ahead and purchase that because there is some fantastic programming that if you haven't seen it, you probably should. The very last thing, again, is to thank our speakers for their generosity and time and everything that they have given, not just to the Atlanta Photojournalism Seminar, but also to all of you. Now we're going to meet Victor Blue. Victor is a New York-based photojournalist whose work is most often concerned with the legacy of armed conflict, human rights, protection of civilian populations, and unequal outcomes resulting from policy and politics. He's worked in several places: Guatemala, covering counterinsurgency war in Afghanistan, Honduras, El Salvador, so extensively through South America and Central America. Most recently, he's done a lot of work in the Brooklyn area. Spends a lot of time, has been documenting, or he's documented the hospitals, or one particular hospital in the Brooklyn area that he'll talk about, covering this for the New York Times. His work has appeared in the New Yorker, in Harper's Magazine, New York Times Magazine, USA Today, Sports Illustrated, Bloomberg Business Week, et cetera, et cetera. And I want to welcome very much Victor Blue. Victor, welcome.
Thanks, Rich.
Yeah,
It's good to be with you guys.
absolutely. So go ahead. So tell us just really quick. I mean, we talked a little while ago about how you got your basic start, and I wonder if you'd start there and then just kind of pick up talking about some of the coverage that you've done in working and covering the coronavirus.
Right. Well, I got into photojournalism a little bit sideways, and I was a little bit older when I started than most kind of students who get into photojournalism. So I started by making documentary photographs in Guatemala when I was in my late 20s, early 30s, and then spent a couple years doing that, and then got my first assignments shooting news photography. Got my first assignments ever from my friends Moises Castillo and Rodrigo Abd in Guatemala for the Associated Press, and then was living in California and started working with newspapers. So I started freelancing for the Bay Area newspapers, and then I started freelancing for the San Francisco Chronicle, and then eventually I became a staff photographer at the Record in Stockton, California. I did that for 3 years. I loved it. I loved every minute of it. I miss it all the time. And then I decided to move to Ohio to pursue my master's degree in visual communication at Ohio University. I did that for 2 years, and then I moved to Brooklyn, New York, about in the end of 2011, and I've been based there ever since. And I work overseas, and I work across the United States, and of course, I shoot photos all the time for my local newspaper, the New York Times. And I have a kind of sort of mixed practice of like kind of long documentary projects that I've been working on for too long, honestly, still probably too many years. And then I do a lot of enterprise stories where I do the research and I do the background legwork, and oftentimes I write the stories as well. And then I do assignment work for, news stories, breaking news, that kind of thing. Um, and then this year, as 2020 began, I ended up being assigned to work in the hospitals in New York City as the pandemic kind of descended on the city for the New York Times.
Okay. Yeah, so that would probably take us kind of into the start of some of the images that you have to show, because the way you see some of these things, I think, is very unique to you, and a lot of people can really start to learn and understand how you see things, but also why it's important that the Times selects certain people in order to tell the images or tell the story from their particular perspective.
Yeah, well, I think that I was a little bit suited to, well, first of all, because of some of the nature of some of the things I've covered before, I'm used to the idea of having to wear a certain degree of personal protective gear. Now we're also familiar with PPE because of the pandemic. We're also familiar with how important it is for all of us, not only photographers working in the field, to mask up or wear face shields or all that kind of stuff, but as my colleagues who also cover this kind of stuff, Carolyn Cole, everybody else, we're used to wearing helmets or body armor, that kind of thing. So I was used to the kind of to having to suit up before I went out to photograph, and I'm used to understanding, assessing, and mitigating risk because of the nature of some of the stories I've done in the past. And so that was a big issue when you were deciding to work in the hospitals, was what is kind of having that daily kind of risk conversation with yourself. Like, what was I going to run into today? What are the risks that I might be facing, and how is I going to mitigate those? I was assigned to cover the hospitals by Beth Flynn, one of the high up photo editors at the New York Times. She's a great advocate for photographers. She's an excellent photo editor and a great leader in photography. And I was assigned to work with Sherry Fink, who is two-time Pulitzer-winning reporter, an amazing individual, an amazing person to work with, unbelievably brilliant reporter, brilliant woman, and she's also incidentally an MD. She's a medical doctor who works as a journalist. So, but she's trained as a medical doctor, and that was invaluable. That totally changed the nature of what I was able to, how I was understanding what I was seeing in the hospitals and how I was able to document it, because I benefited from her background and her brilliance, and also because Sherry is so experienced and had covered the Ebola crisis so bravely. I benefited from her experience with the PPE and her experience at mitigating the risk of infection while we were in the hospitals as well.
Mm-hmm. So the first couple of images, I understand that they'll walk us in through this kind of this view of the start of coronavirus and what it looked like for a lot of us, the vast empties, so to speak. So why don't we go ahead
Right.
and start, and we'll kind of get into where we're going to step into the hospital, because there's a lot of information that I think that you bring up, that mitigating risk and making decisions, that I think people, when they hear how you weigh that against the greater good of getting this information versus the risk you're taking, will be very interested in hearing how those decisions are made and how you got to those places. Go ahead.
Right. In early to mid-March, the pandemic began to descend upon the country, and it descended on New York really quickly. And New York it felt uniquely unprepared for what was to come. It's crazy to think about, with just a little bit of hindsight now, what the initial days felt like versus what we know now. So I began I was assigned to photograph on the streets in New York and to photograph the rapidly emptying city and the new reality that we were all settling into, right? The new the new being alone, the new being isolated, this new feeling of uncertainty that was descending on us. Um, it was it was a time of it was a time of instability. It felt unstable in the city. No one knew how bad this was going to get. No one knew, numbers wise. And then it was so rapidly politicized that it was being in New York City. It took a minute to realize that we were going to become the epicenter. And then by the time you realized that it was the epicenter, we were already so deep into it, so I was out walking the streets, assigned by my editors to photograph on the street, to photograph people in masks and how people were starting to kind of navigate this new reality. Um, I did about about a week and about 2 weeks of that. Trying to find interesting pictures on the street, trying to find folks who were on the front edge of understanding what was going on, often evidenced by their wearing masks. Now it's so ubiquitous, but it's so funny to think about. I'm sure my fellow photographers can remember how weird it was running around the city trying to make pictures of people wearing masks, and how the social kind of dynamic of that changed so fast, right? Like at first, people that were wearing masks, I think they probably felt a little ostracized. They felt a little bit separate. People looked at them as if they were hypochondriacs, or kind of othered them a little bit, And then now we all know that it's almost completely flipped. Like at least in New York City or in other major cities, if you're walking around the street without a mask on, people kind of feel the opposite way, or they kind of react the opposite way towards you. It was a very interesting time, very interesting dynamic. And I think in hindsight, it's crazy how many folks that we saw wearing masks at that time who saw ahead of us, who knew ahead of us what was coming. So soon after that, in about the third week of March, I was called by my editors, by Beth Flynn, my editor at the New York Times, who asked if I wanted to accompany Sherry Fink on a visit to the Brooklyn Hospital. Initially, we were invited to the Brooklyn Hospital to photograph their COVID testing tent. They had set up a tent outside the hospital to accommodate all the folks who were showing up to try and get tests. Of course, we all remember that was a time when tests were very difficult to come by. There weren't many tests being done, and people were lining up to get tested. So we showed up initially at the Brooklyn Hospital and spent a day, and really quickly we established a good rapport with the hospital staff and administration, and started to kind of get into it. We went from the testing tent into the hospital and photographed and reported on a lot more than just the testing tent that day. And that started a kind of relationship where we were going back over and over again to the hospital to work. We also were eventually invited to work in a couple of the hospitals that belong to another hospital system in New York City, the Northwell system. This is Long Island Jewish Hospital. We spent a few days there and a day at their North Shore facility as well. And so, yeah, I ended up sliding into this kind of strange pattern of working both inside the hospitals, 2, sometimes 3 days a week, and then outside the hospitals, kind of on the street. So I had a weird sort of through the looking glass almost experience, right? Where because there was so little information, it was such a confusing time. We were trying so hard to understand what was happening, and I felt very much like a messenger, even more so than you normally are as a photojournalist. I felt like I was visiting this strange, almost distant land, a very little understood place inside the hospitals, inside the ICUs, and then coming back and sharing the experience on the street with everyone else in New York.
You bring up the idea of kind of being in this foreign place where people don't necessarily get to see, unless of course they're sick, or if they work in healthcare or whatnot. This brings up, I think, one of the things that we had talked about a little while ago, and that is, like, why do it? What was important about not just making pictures of course, the early pandemic? We see a lot of these images in conflict areas, a lot of work that's done in hospital and in conflict zones, but not a lot in the United States. So what was really one of the important things that you helped pull out, and that Sherry helped pull out of this hospital coverage in the city, especially at the time when hospitalizations were skyrocketing, and a lot of people were very scared. So talk a little bit about the purpose that was behind, and what became or what came out of the coverage.
Well, first, I think the important thing was that you're right. We're used to seeing these kind of images. I've made these kind of images in hospitals and in other countries and places that are in extremis, in a conflict or a disaster area, right? And we weren't used to seeing this in our own country. And I think that was part of the shock for our audience. That was part of the shock for American readers, that this was happening in our own country. And as I said earlier, the pandemic was so quickly politicized, right? It happened so fast that it quickly politicized and polemicized in the debate, and so we felt a real burden, like we felt a real weight to go inside the hospitals and bring back the reality of what was happening to people that were coming down with this disease, and to document the battle, I mean, the frustration of the physicians who were trying to save them. We spent the vast majority of our time with critical care physicians in ICUs, pulmonary critical care physicians, oftentimes, who were baffled, who could not understand this virus, could not understand what was happening, and were trying in real time to figure out why so many people were dying around them. And we were trying to bring that reality from inside this kind of rarefied, dangerous, but also a very intimate and very private place out to readers, to give them the tools they needed to understand what was happening in our city and in our country.
Mhm.
And so I think, hopefully what happened was we were able to bring people into this place, bring readers into this place, and give them the information they needed so that they would protect themselves and their families, so that they would limit their contact with other people, so they would stay home, so that we could flatten the curve, so that they would wear masks, so they would follow the advice of public health officials. And it was a strange thing. It was like so clear cut what our role was as journalists. It was very kind of journalism 101. People were talking about that it was only the flu. People were talking about that it wasn't so serious. People were talking about, that it wasn't such a crisis, that most people were recovering. It was only old people that were dying. It was strange. And not only politicized people were saying that. As soon as anybody heard that someone they knew had died from coronavirus, or heard about a death from coronavirus, the automatic question was, well, were they old? Did they already have a pre-existing condition?
Mhm.
Could this happen to me? Am I vulnerable too? And what we were trying to show people is that, yes, we were all vulnerable. And even if we weren't individually vulnerable, our society was so vulnerable. I think that
Mhm.
was one of the main things we tried to bring out of the hospitals. This reality of how vulnerable not just the patients were, but our society was to the virus.
Mhm. It, it there was another layer of vulnerability, as the images that are about to start to come onto screen now really show, of not just the patients, of course, which yes, patients are the crux of coronavirus and the crux of COVID-19 and how it was affecting people. You started to show this vulnerability of the healthcare workers that were, the helpers, basically. And this is something that a lot of people tend to look at as, well, they're healthcare workers. They're supposed to um, work in this impassioned, or I'm sorry, this kind of detached way, so they can do their job. But that's not; those aren't some of the images that you actually captured, is it?
Right. Well, that was a major challenge. There's no question about that. I mean, everybody in the hospital is covered in PPE. And like for me, the best journalistic photographs do two things: they move you emotionally and they inform you intellectually. They have to do the two things to be successful. If a picture is only emotive or only kind of sentimental, it doesn't fulfill its role, you know. And if a picture is cold and distant and doesn't communicate the human impact of whatever you're documenting, but in this case of the coronavirus, it misses the mark as well. And this was a constant challenge for everybody who photographed in the hospitals, for everybody who photographed coronavirus period, was and because everybody was so covered up, um, it was more difficult to get at some of the human kind of feeling what was going on. But it's true, the doctors were baffled. They were not just exhausted, sick. Most of them were sick. I mean, most of the people that we ran into in the hospital ended up sick from coronavirus at one point or another. Um, they were, but they were scared. They were scared. They had been through years of training for this moment, and they were kind of, surprised. They were surprised, and they could not understand why their patients were not making it. It was a dark time. You know, um,
Mhm.
I think that that was a challenge to communicate, but it was one of my main goals in the coverage.
Yeah. Go ahead and keep rolling through some of these images, and I wonder if you would talk a little bit more about. I mean, not necessarily how we get in and make the pictures, but what are the kinds of things that you were navigating? I mean, aside from being able to or needing to wear PPE, aside from making sure that you followed protocols, and I think aside from some HIPAA restrictions, but what are the things uh, that you were navigating in order to form some relationships to be able to gain trust?
Right. Well, it was interesting. Whenever you're and walking into a place that's not used to having journalists inside of it, that's not used to having observers. There's the initial awkwardness that you're taking photographs, and people hear the click, or they want to know what is he looking at, or what did he see, or why is he taking a picture at that moment. Um, there's that kind of thing, and then of course there is the risk of the virus, and trying to keep ourselves healthy and trying to keep ourselves from getting in anybody's way. People are saving lives. People are trying to are having medical interventions that are critical medical interventions, and so we had to figure out kind of the symphony, kind of the dance of that pretty quickly, and make decisions about what when am I going to go in a room, when am I going to go into a COVID patient's room, when am I not, and then of course, like you said before, navigating the HIPAA stuff. I mean, I have a lot of opinions about how that worked. One of my main frustrations in this work was that more photographers didn't get access to the hospitals in New York City. That was a major, major problem, and it was a major mistake by the medical community that they didn't make room for more coverage inside the hospitals. That 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 really limited people's ability to understand what was going on in their city, what was going on in their community.
Mhm.
I'm thankful that I got to, but I was not enough. I was not enough. But and then one of the other things, one of the things that happened from spending so much time in the hospitals, that I was thankful for, right? That we weren't going kind of just in for an hour and out. We were spending hours, and we were spending entire days, 12, 14 hours inside the hospitals. Um, and we had the ability to kind of search for stories. And we realized really, really rapidly that the defining aspect of the pandemic was the inability, was the level of death, and the inability for people who were losing their loved ones to be present with them while they were dying. And Sherry and I decided very quickly that we were going to need to do a story about this. We were going to need to accompany a family as they had said goodbye to a loved one from COVID. We were lucky that we met through North Shore Medical Facility, a Northville Hospital, Edelson and Eliana Rendon, who are pictured here. Eliana's grandmother, Carmen Toro, was in the hospital and was not doing well. She was not recovering from her COVID infection. The family was divided between Queens, Florida, Colombia, a couple other cities. And the family agreed to let us accompany Eliana as she was granted access to the hospital to say goodbye to her grandmother. So Sherry and I spent some time with the family beforehand. We were on a couple of calls with the family as they got the bad news from the doctors that their grandmother was not recovering, that it looked like she wasn't going to recover, and as the family made the decision to withdraw care. So Sherry and I accompanied Eliana and Edelson to the hospital while they withdrew care from her grandmother, and she passed away. And for us, this was probably the key story that I think that we did during the pandemic. The death. One of the things that the coronavirus exposed in our society, among the many things that the pandemic has exposed, is as Americans, our often dysfunctional relationship with death. We have a weird we keep death at arm's length in this country in a way that many other countries don't. We have a weird kind of fetishization of hiding death. And I think myself and my fellow photojournalists ran up against that over and over and over again in trying to cover the pandemic. In New York City, there was a cat and mouse game of trying to photograph the morgue trailers that were parked outside of every hospital. There was, the restrictions on access. There was a real effort to hide away the reality that was happening. I mean, 22,000 people died in New York City alone from the coronavirus, and so our ability to spend the day with Eliana and with her grandmother Carmen as she passed away from the disease, I think was a really important view and a really important story to tell our readers, to show them the pain and the loss that was going on all around them every day as everyone was locked up inside their houses. That for me was one of the more important stories that we were able to do, and that came from spending so much time in the hospitals and being able to talk to folks and gain their trust and do a story like this.
Yeah. As you keep going through some of these images, of course, the work here is showing that it's not just this virus. There's human consequences. You're pointing out really important stuff. One of the questions that's coming in from Sue Morrow is, what kind of feedback or responses have you gotten from the medical community after seeing these images? Do they open up more? Did they understand the value of the work? What was the feedback you were getting?
It was interesting that the doctors and nurses were almost always happy that we were there, almost always glad to see us, almost always open and welcoming, almost always appreciative. I think I only had one moment, and it was just a misunderstanding where there was a kind of a odd moment with a doctor or nurse. They were glad we were there. They wanted us there. I mean, the folks that aren't so open to journalists, and the folks that weren't so anxious to have us in the hospitals were, folks that work in other roles, people that work in public relations, oftentimes public health, some, kind of that situation. But the doctors and nurses were open to it, and gratifyingly, I've developed relationships with a lot of these clinicians. I've spent time with them in the hospital, and we keep in touch all the time. They're proud that their work has been so prominently featured, and that people understand what they are going through as well. And of course, gratifyingly for me, some of them have reached out and asked for images, not just for themselves personally to as keepsakes, but also to help them cope with and kind of get through or revisit what they went through, because it was all kind of such a blur at the time. There's a group of doctors at Long Island Jewish Hospital that asked me for a bank of photographs and videos because they had a big meeting where they kind of had a little bit of an after action, kind of a session to kind of open up and discuss what they'd all been through together. And I was gratified that my pictures and video footage helped them do that. So that was very gratifying.
So yeah, as you keep running through some of these images, it's the document is this. It just looks like this communication of grave need to pay attention. Am I wrong on that? I mean, and I know we've been talking about that. You've been making that point really clearly. The the importance at this point, and this was what, March, April, or something like that.
Yeah. Mm-hmm.
Yeah. So it's still very early on. I mean, like you were pointing out earlier, this idea that oh, it's just the flu. It only kills 1% of people. It only does this. It only so the grave need to communicate this information, and the cost that it's having, running it, of course, as you're pointing out, up against limitations in access, limitations in I guess if you recall going through school, the what we would call the breakfast test. If it doesn't necessarily pass it in the United States, it doesn't get into the paper. How difficult as a journalist is this for you to, especially someone who's worked overseas, and covered conflict? How difficult is this to swallow, so to speak?
Right. I'm well acquainted with this concept of the breakfast test. It's a concept that I do not that I don't appreciate. I wish we could get away from talking about this. I think that part of the reason that many of the intractable problems our society faces can't seem to be solved is because we're unwilling to look at the reality around us. Right. We're unwilling to look at images of death and of suffering. For some reason, photographers seem to be penalized for making those images or publishing those images, which I always think is so strange because no one ever yells at writers for writing about death or suffering. People are always so angry at photographers. I think that every time that happens, every time I get pushback, every time someone complains about a graphic image that I've taken, I take that as, I take the criticism in stride. I try to understand where people are coming from, but I also take it as a kind of implicit endorsement of the power of photojournalism, how important photographs are and how powerful they are, because they stick in people's minds. They are hard to look away from. This is a photograph inside one of the morgue trailers filled with bodies, while one of the morgue workers searches for a body to take out and give over to a funeral home. There were very, very few of these images made during the pandemic, far too few of these images. And I can't help but I take it as a given, not even as a given. I know it's the case because when I would tell people about my experience inside the morgue trailers, they were blown away. This scene was a lot of folks worked very hard. People in power worked very hard to keep these kind of scenes from being seen. This does not look good for a politician, left or right. The city of New York did their best to keep these kind of images from being made. It's a scene that voters, taxpayers, citizens are going to ask questions about, and they need to ask those questions of people in power. And so, for my money, we didn't make it. We weren't able to make as many of these pictures as needed to be made. Another image of the morgue trailers.
Yeah. So as you keep going, there's an importance, and so not just to pull back from the importance and the poignancy of what we were just discussing and the point you were making. There's also a personal risk. You started out, Victor, talking about personal risk and talking about that this is something that you get called for. This is something that is important, not just to you, but that the folks that you work for know that you know how to take care of personal risk. So, uh, of course, and dealing with a new contagion, how was it? So after a day of working, you get to work, you suit up with PPE and make sure that you were sealed up. But how are you coming home, and how are you dealing with the cleanliness of not just yourself, but the gear?
Well, yeah, that was that was my girlfriend can attest to the process that entailed. Yeah, I would call home, say when I was going to arrive. We would have plastic laid out in the vestibule of our apartment. I would deposit all the gear, take off all the clothes, all the PPE, bag all the clothes up in a garbage bag, toss out the PPE, any that I still had at the time. Shower, clean myself up, and then get to work on cleaning the cameras with alcohol and wipes. Trying to keep those as trying to clean them because I was coming home radioactive with COVID. At one point, I ended up at one point I photographed a tracheostomy, which is a procedure where they open up an airway in the neck, and a lot of hospitals refused to do them because they were the most. That was the procedure that exposed their staff the most to COVID, to COVID, to the COVID virus or the coronavirus. So I was coming home covered in COVID, and then doing our best to keep our apartment kind of a clean zone. And of course, for weeks and weeks and weeks, we social distanced inside our own apartment as best we could. And but I mean, part of it too was like, I think that kind of what you were asking me earlier is important, and I think that one of the things that helped me personally, and I think also helped my girlfriend as well, through what was such a trying, difficult, confusing time, was having a sense of purpose. Like I knew how important it was to go in the hospitals. I knew how important the story was for the readers of the New York Times, and I was that kind of helped me get up in the morning. It helped me keep going. It helped me deal with the oftentimes like exhausting mental load of going in and out of the hospitals, being exposed to COVID multiple days a week. Was that I felt like I had a sense of purpose. I knew how important it was to go. I knew how important what we were doing was, and it kind of kept me going,
What
honestly.
was your logistics of testing? Yeah.
Honestly, the whole time I was shooting this, there was no testing available in New York City unless you showed symptoms or you had been directly exposed. And at the time, under the criteria, because we were covered in PPE and we didn't fall under that. We didn't get a chrono test the whole time while we were working. So yeah, that wasn't it. I mean, at one point, actually, the Brooklyn Hospital started doing corona tests in the hospital. But like when I was shooting most of these pictures, you would have had to wait a week or longer even to even get results from a corona test. So it wasn't part of the equation. We were just trying our best to be really, really careful, follow the leads of the healthcare workers that we were documenting. They were incredibly generous with their time and their expertise in trying to keep us safe and showing us how to don and doff the PPE to stay as safe as possible.
Right. So, I mean, we talked a little bit about this earlier as well. Not just worrying about physical infection, but what was the toll, if any, that you paid from a mental health perspective? What did you do aside from looking at purpose, as you'd stated very, very eloquently a little while ago? What else did you do to make sure that you were continuing to go back there and mentally healthy?
Yeah, that's a good question. I did a couple things. One was that I was very, very fortunate to be working with my reporting partner, Sherry Fink. We were constantly, um, every day, often in real time, processing what we were seeing, trying to understand it both like in a repertorial way, and then trying to understand it as people. and we talked. We talked a lot. I also was spending. I spent quite a bit of like personal time. Like I would have my time where I sat quietly by myself. I had my time when I would sit quietly in the car, think about what I'd seen. This is an image of a particularly tough afternoon. We were working on a story about respiratory therapists, and this woman, we were standing there as they withdrew care from this patient. She died as she was dying as we were documenting her, uh, um, and the you feel a kind of solidarity with these folks. They're unconscious. They're not ever going to know you were there. You're doing your best to protect their privacy in this moment. But you feel a kind of solidarity with them. You feel a kind of like that you want to, even though, again, for privacy reasons, we're unable to kind of say too much about some of the folks that we documented because we don't have permission from them or their families to do so, but you still want their death to mean something. And for me, the meaning that I can help communicate of their death is that hopefully it won't be in vain, right? Is that hopefully there'll be a lesson that they help the clinician learn how to do their job better and save the next person, or that they, it's something to fight back against the loss. So yeah, I spent a lot of time thinking and trying to understand and trying to come to grips myself with what was going on.
So one of the things, of course, from a mental health perspective is being able to make sense of this. And it sounds like both of you did a lot of work in that personally. And one doesn't necessarily have to have a psychotherapist to be able to do that, just to be able to know and understand that. So definitely hats off to you on that. One of the things that one of our viewers, Terry Eiler, was asking was to compare how you dealt with mental health, if it was different, working on this here in the States versus some of the things that you did, for example, in Afghanistan.
It was similar in some ways. I think the thing about working out here in the United States that was, I think that it was a little tougher for my colleagues. I think that so many photographers I know aren't used to a crisis coming home like this. A lot of my friends that are everyday news photographers like myself in New York City had a tough time, I think, adjusting to it. I think for me, because of what we were talking about earlier, because I have over the years developed a kind of a process for how I internalize what I'm seeing and how I move from documenting it to understanding it as my own experience. I have a kind of system in place to do that, and that helped me out a lot. I've had close calls overseas. I've had close calls covering conflicts in the past, and I've had to come to a kind of terms with the potential costs of my job, the potential costs of what I do, and that kind of puts it in crystal clear relief, the value of the work. And I believe very, very strongly in the value of the work. I believe very, very strongly in the value of the images and what they did for our readers, and that helps out a lot. But the process of having close calls, of dealing with this stuff, and continuing to move forward. That I learned overseas, that I learned covering shooting wars, and then I used every day covering COVID, certainly.
Yeah. So we've got about 5.5 minutes left, and I want to make sure that we keep going through some of the, obviously, about, I think,
yeah, I'm going
we've got
slow,
about
sorry.
Yeah. No, you're fine. But I just wanted to make sure that we're going to see the work, because it's important stuff. And so as you keep going, Daryl Johnson asked what measures, if any, were there to circumnavigate any political resistance you and Sherry dealt with. or the hospital dealt with, or hospitals?
Right. Well, this is another place that we really got lucky in that Sherry, especially because of her stature in the journalism and in the medical community, um, already up front had a degree of trust. Doctors wanted to talk to her, hospital ministers wanted to talk to Sherry. Um, and then because we worked together day in, day out for 6 weeks on this, they quickly understood we were able to explain very quickly what our role was. You know how it is when you kind of go out and you're shooting and somebody gets mad at you in the street for shooting photos, and you have to have kind of a quick civics lesson, right? You have to be like, well, actually, this is what I'm trying to do. I'm a journalist. I'm not trying to, I'm trying to show the reality of what's happening here. Blah, 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 blah. So we would kind of have Sherry and I together were able to kind of have that conversation with administrators, with public information people, um, and they were to build trust. And the other way we built trust, of course, was in the publishing. Like Sherry was extremely generous about helping me identify pictures that might be problematic as far as HIPAA went, as far as guarding people's privacy. And we were extremely careful not to publish any images like that. And the hospital saw that, they appreciated that, and we were able to kind of keep going because of that. So, as far as the political blowback goes, we didn't personally get a lot of political blowback, and I can't think of an example of one of the hospitals we worked in where they were angry with us about any of our coverage, or where they had any where they thought that we had crossed the line ethically or anything like that. And we went pretty hard after people a couple times, or we asked tough questions. Sherry asked really tough questions. I think the pictures asked tough questions about the care people were getting, and was it and we weren't in a position to second guess doctors, but we were in a position to ask about what the best practices were as we were learning about it. So I was proud of her and her endeavors in that regard.
Yeah. So looking back in the closing couple of minutes, looking back on it now, especially, I mean, where are we? Holy crud! This is November.
Yeah.
So I guess this is 8 months later. Have you, aside from of course, all the things that we've discussed, what's your take home now, or what's the take home now, 8 months later, especially considering all that we've learned about coronavirus and treatments that are being forwarded, or treatments that are advancing and helping us to reduce the death rate that was once higher, but now, of course, is getting better. But obviously, we still need to keep a very high vigilance for this. What are the takeaways?
Well, I think there's two things. One is that I'm very proud of the clinicians that I met and spent time with, and how much they've learned about saving lives. We know now that people who are hospitalized with COVID have a much better chance of surviving. That the clinicians they work so hard. They try everything. They do everything they can for their patients to keep people breathing, to keep people alive. And it is crushing to watch them suffer psychologically and emotionally when they don't succeed. But they have learned so much, and they've done an amazing job at being reflexive, at being flexible, at learning in real time what was going on. And they're saving lives every day. And so for that, I think the rest of the country is benefiting. And for that, I think we can be really proud. On the other hand, it's just unbelievable. As you said, it's been 8 months, and the continuing politicization of this virus is unbelievable. It's unconscionable. I happen to be in Washington, D.C. today. I live in Brooklyn, but I'm in Washington, D.C., and I photographed this large pro-Trump rally that descended on Washington today. And again, after the number of deaths, the number of infections in this country, it's unreal the way that it's still politicized. It doesn't make any sense. And I feel it really hurts to watch us kind of be unwilling to learn our lessons on that. It was weird. One of the things that I felt like during the pandemic in New York, in the darkest days, every night it was mentally exhausting listening to the sirens up and down the streets, bouncing off the walls. unable to understand. You knew what every one of them was. Every one of them was going to a house to pick somebody up who was sick with COVID. And the lack of solidarity you kind of felt around the country, that you felt in New York City from the rest of the country. And I don't think we've quite wrapped our heads around that yet. I think that's a really sad state that we're in. And I hope that we can get around that as a country, or we're not going to get out of this pandemic.
Yeah. Well, Victor, we definitely want to say thank you very much for sharing the work that you've done, the expertise that you've shared with everybody tonight. And I can't say it better than Eric Draper just did on our chat. And I'm going to quote him, especially coming from someone like Eric. Powerful work. Thank you for your commitment to this story and sharing your experiences. I can't say it any better. Thank you very much, Victor.
Well, I appreciate that too. Thank you guys so much for listening, and thanks for tuning in if you did. And I hope everybody stays healthy. I hope everybody stays safe and healthy out there.
Absolutely. Thank you very much.
Absolutely.
And now, yep, and we're going to take a short break. Don't forget that we still have pre-sales for access to all of Saturday's speakers to watch them again or watch them for the first time. $29 until the end of today, and I'll be back with some more announcements and everything after a short break. Victor, again, thank you very much.
Thank you, guys. Goodbye.